We're live.
Good morning, everyone. It is February 25th, 2025. My name is Deanna Diamore. I'm the Director of Health for the City of Norwalk. I'm calling our February 2025 meeting to order. We have board members Frank Ehrlich, Anthony Santella, Norman Weinberger, Joan McNeil. We also have staff members, David Reed, our medical director, Megan Fogno, our special project manager, Brian Weeks, our program director of epidemiology and informatics, Kelly Tomlinson, our health educator, Omar Perez Rivera, who is our community health worker. Did I miss anybody? Okay. Our next item is public participation. Is there anybody who would like to speak? You can raise your hand. All right, I'm not seeing anybody raising their hands. Megan, there's a phone number. I'm going to see if that's Dr. Karpiak or not. I'll take a look.
That's what I was going to ask you.
Okay. All right. And also noting at 8:03, we have Ken Laline joining us, who's our board member. Great. Now we have acceptance of the minutes. Do I have a motion for the accepting the minutes of the regular meeting of January 28th, 2025?
I will move.
Joan moved. Do we have a second? Oh, Anthony, I see. Thank you. Any discussion on the minutes? Any edits or revisions? All right, hearing none, I'll call for a vote. All those in favor of approving the minutes, say aye.
Aye.
Any abstentions? Any nays? All right, minutes passed. Thanks all. Next on the agenda is our epidemiology update. So I'm going to pass it to Brian Weeks for his updates. A lot going on right now. So thank you, Brian. Well, I'm sure it's going to be a really great presentation.
Sure. Good morning, everybody. Thank you, Deanna. Thank you, board. So yeah, I'm just gonna do a quick overview. I'm gonna focus on two things: respiratory viruses and just kind of keeping an update and tabs on that. And a reminder again in terms of the prevention that we're always very familiar with, and then also just mention really quickly about measles outbreaks going on across the country. And I think also a nice segue to some of the later presentations. So with that said, just jumping right into the respiratory illnesses data channel from the CDC. We're looking again right immediately at the snapshot for the nation. The overall respiratory illness activity in the country is at high. Again, 'tis the season. We're still in the midst of it. The emergency department visits in the United States is very high for flu and an increasing trend. RSV is at moderate levels, decreasing trend. COVID-19 is at low with decreasing trends at the moment, with the data currently indicating. Wastewater viral activity in the country is high for flu, moderate for COVID-19, and then low for RSV. And again, the really important thing to factor in is emergency department visits are indications of severity, immediate outcomes. Somebody has to go to the emergency department. Wastewater viral activity is a good indicator of what's going on in the general population that's resulting in either mild asymptomatic as well as severe illness. But then along with that being a good predictor of what's to come. And so again, flu kind of being general alignment, but then COVID-19 still kind of being somewhat of an indicator of potentially increasing as well. And again, as I mentioned previously in the past, it's 'tis the season as well because spring break's kind of in action right now as well as into March. And so we usually see that bump for COVID. And again, we haven't really seen a bump since late last year. So this is kind of making sense in terms of anticipating it making a little bit of a comeback. And just being prepared for it. So then looking at it for the state of Connecticut, again, respiratory illness activity is high. Emergency department visit activity for Connecticut is very high, and increasing trend for flu, low for COVID, and decreasing trend for RSV as well. But again, wastewater viral activity is indicating flu is high, COVID is high, and then RSV is low. So again, kind of further substantiating that trend and expectation of, again, flu kind of holding steady, but generally speaking, COVID-19 wastewater viral activity being a predictor of something to come. So looking at it more explicitly for emergency department visit data, looking at the trends in the charts, CDC has updated their visual once more. You can see it's broken out. It's not like that line chart that's all on one visual. It's separated out, but at least it still maintains the same kind of scale. So you can see that 10% is kind of the top here. This is looking again for the nation, so you can kind of see where COVID-19 is. Influenza being, much more strikingly higher than the others. And then RSV kind of being much lower in terms of, getting closer to baseline activity, but not quite there yet. And then when you look at it for the state of Connecticut, you can see that it updates the same way, more or less, with that trend for influenza being very high and strikingly high compared to the others. Still COVID-19 can be in a position where it can jump up, and we should be kind of anticipating or being preventative towards that. But then also with just influenza, we have a couple data points now that indicate somewhat of a downtrend, but we'll see once you get a third data point what that indicates, because again, it could always spike up once more, given that we're still in late February. And then with that said, this is the NRE-VSS surveillance from the CDC. So this is giving us a better idea, besides the big three, but along with it, what else is circulating and the trends there. This is weekly percent of positive tests that are reported to the NRE-VSS. And so with that said, you got flu, that's the highest, right? And then along with that, we have rhinovirus and enteroviruses. And again, rhinoviruses are part of the common cold. Then you have, respiratory syncytial virus kind of competing next to the human coronaviruses. So that's the coronaviruses except for COVID-19. Then along with that, just SARS-CoV-2, which causes COVID-19. And then, the mixture, kind of what comes a little bit later in the season, the lesser known viruses that do circulate at this time, though. And when we talked about at the last meeting, the human metapneumovirus, parainfluenza, just kind of these lesser known viruses, but they do circulate, and they definitely do have an impact, especially those that are really young, elderly, immunocompromised, immunosuppressed. And so again, it's always just a message to the wise and to those that, to do their best in terms of prevention. And again, just a reminder about this, kind of the core prevention strategies, this great infographic, immunizations for those that we can get immunized against, doing that hand hygiene, respiratory etiquette, seeking that cleaner air where we can, especially HEPA filter indoors, if especially the weather's too cold out, we can't open the windows, or host events outside. But yeah, again, make sure it's a MERV 13 or better filter treatments. Like there's antivirals for flu as well as COVID-19. It's following up with your healthcare provider as soon as you can, because the sooner there's the better. Once confirmed, to get those treatments. And then obviously the most important that really breaks that chain of transmission is staying home and preventing that spread. So if somebody is sick, wait until your symptoms are better and you're fever-free without any sort of fever-reducing medications for 24 hours, and taking those extra precautions for 5 days. And again, that's the masks, distancing, especially those much more susceptible to the illness. And then testing, especially for COVID-19. If you're testing positive via rapid test, that means you are still shedding the virus and still in a window of infectivity that can transmit to others. And so just, kind of restarting that cycle if testing positive once more. So that is the overall respiratory virus situation. Just jumping really quickly to the CDC surveillance for measles. So again, this is a vaccine preventable disease. There's vaccines for it. CDC is actually going to be updating this on a weekly basis now, which is very important because we have a lot of measles cases going on in the country and related to outbreaks. Total of 93 now since for 2025 up to February 20th. That's in 8 jurisdictions. So that's Alaska, California, Georgia, New Jersey, New Mexico, New York City, Rhode Island, and Texas, right? Emphasizing New York City and Rhode Island. And so, yeah, there's about quite a bit in terms in relation to outbreaks. And so it's about 92% of those cases, so 86 of 93. So again, not a great situation. So what does that mean? Somebody's, whether it's related to travel or whatnot, this individual is presenting with measles and then infects others. And again, measles is one of the most infectious viruses. So, the saying kind of goes from the CDC, if you're in a room and there's 10 people, 9 out of 10 will be exposed to measles if somebody's in their infectious window in that room. And so again, very easily preventable via vaccines, but people have to be up to date relative to and getting the 2-dose series. So, that is kind of the caveat. A lot of these individuals are not vaccinated against it that present with this illness in these outbreak scenarios. And so it's especially in regions or parts of the country that are not up to date with those vaccines. So that's just the other important to emphasize here. And again, the ages that are impacted, about 30% under the 5 years of age, 52% 5 to 19 years old, 16% 20 plus, and then age unknown is about 2%. So As you can see, 95% unvaccinated or unknown vaccination status. And so, again, some of these also result in hospitalizations. And so, 25% of the cases hospitalized for isolation or for management of measles complications. And so, we do also have severe illness that manifests related to this too. And then sequelae. So, sequelae is just long-term complications as a result or morbidity after infection. So, again, emphasis that, the vaccination is the name of the game here, and just general awareness. And so, it's just really important that people are just up to date with these vaccines so we can kind of mitigate and stomp these outbreaks out, because again, this is just not a good way to start the year, and much higher in terms of just these number of cases. So just want to hit that home, and especially again, its proximity with New York City and Rhode Island, and these cases do happen sporadically throughout the country, but yeah, the CDC has decided to report this weekly just because this is not that good, especially relative to this year. So just emphasizing that point. So overall, just wanted to kind of keep a quick update about, more urgent circumstances. Again, getting to the respiratory virus season. We're still in the midst of spring break kind of starting. And it always usually results in some uptick of some sort. And so whether that's, the flu maintaining with its high status, but then also COVID-19 kind of entering the picture once more. Then along with that, for vaccine preventable diseases with measles kind of really, running a little bit rampant in terms, especially those that are unvaccinated and vulnerable to the illness in the United States, in these, pretty large geographic spread of communities here right now. And again, we're only in February, late February. So just emphasizing the point. So that's my quick overview for today. Thank you, everybody.
Thank you. Oh,
Thank you so much, Brian. Does anybody have any questions?
I have a question. Hey, Brian, is there any issue with information coming out from the CDC? Are you having any problem?
Yeah, so Dr. Weiber, you're asking a very good question. And the answer to that is, yeah, there has been disruptions, data that has been changed, whether we're looking at just for infectious disease, even chronic disease, looking at social determinants of health. There have been modifications and sometimes questions about the reliability of that data now. So yes, this has been a interesting road since these amendments and modifications to these data sets, access to them, and reporting of them. But fortunately, CDC is, with the measles situation, changing the reporting schedule from every so often to now, especially weekly, every Friday that's getting updated. And fortunately, there wasn't disruption to the respiratory virus activity data, and they changed that visual, as I mentioned. But yeah, there's just general reduced confidence in terms of things being the way that they even currently are. But then also sometimes what happens to that, and things seem to be changing every moment to moment with current administration. But I'll leave it at that. But yes, it's an excellent question and an excellent point. Thank you.
Brian,
Can
this
I,
is Joan.
Joan, can I just add one thing for that before you ask your question? Just want to add that the CDC has resumed their calls with state and local health departments. They've, had calls and they were put on pause for a little bit, and they have resumed. So that is some good news. Joan, sorry.
Brian, is the State Department stepping up their reporting or no?
A lot of this data, especially nationwide, the State Department can't really quite report out. But, they've done a very good job, and the different departments at the state working together to supply information, different fact sheets, also. So I would say, yeah, I mean, more or less that has been stable, generally speaking. I don't think it has really shifted too much from general performance or expectations. But yeah, unfortunately, at the federal level, that's where the variability has been presenting over the last couple of months.
No, I was just wondering where we can go to get reliable information if we can't get it from the CDC. All right, thank you so much.
No problem, Nick.
Any other questions? All right, and I just like to highlight this another example of why it's so important to have these local resources here and the local staffing here, both local and state. And so thank you to Brian for keeping your eye on all this for us and for reporting it. All right. Next item on the agenda is the rapid community assessment. So we have two really great people to present today. We have Megan Fogno and Omar who Rivera. I know you all know Megan, but she's been leading these efforts. And Omar is our community health worker. I'm not sure if any of you have met him yet, but he's been a great addition to the team. So Megan, I'm going to pass it on to you to lead this presentation.
Thank you. Good morning, everyone. I'm just going to be sharing my slide. Everyone can see my slides?
Yep.
Good morning, everyone. Like Deanna mentioned, myself and Omar have been working tirelessly on this RCA rapid community assessment. And today we're just going to present a little more information. I know we presented last April on our efforts, and now we're just going to present the final report that we've been working on. So a little bit of background on this grant. It was received from the Connecticut Department of Public Health. It is immunization and vaccines for children COVID-19. The grant period is from December 2023 to June 2025. One of the deliverables of this grant was to conduct an RCA, and we conducted our RCA in the spring of 2024. Quickly, just to explain, I know I've mentioned this on past meetings, what an RCA is. And so RCA is a process for quickly collecting community insight about a public health issue to inform program design. So we focused our RCA on routine childhood immunizations, but you could really do an RCA on any public health topic that you're looking to get more insight from the community on. The assessment involves reviewing existing data, conducting community-based interviews, listening sessions, observations, social listening, and surveys. And I know previously we did conduct a lot of those things in the community, and we'll share more on those. And then finally, we developed a summary of the report, a summary report of the findings from this assessment. And the image to your right is the cover of our RCA final report there. And I first just want to thank Omar, Teresa, and Brian for all the assistance in developing this report. It was all hands on deck from the creating, the writing, making sure all of our charts and graphs and everything was accurate. So it was a lot of work, and I just want to thank them for all that. And also Deanna for doing that final review for us. And so just wanted to let you know how we're sharing this RCA and how we're sharing the data from that. So I know sometimes we, sometimes things are collected and then you wonder how we're sharing them or if we're sharing the information back out into the community. And so we have some posts. Sorry, I heard a beeping. We have posted this on our website in 2 locations. The one there is linked at the bottom on the norwalk.gov/vaccines. You can see that the report there, but you can also find it on our childhood immunization page as well, the full report. We're also going to be sharing this out with community partners. So we partnered a lot with different partners in the community to conduct the RCA. And so sharing the information back out with them is really important. And then we also have some social media posts that will be going up in the near future. I'm going to show you 2 examples of those. And then again, presenting it here at the Board of Health meeting. And so these are just 2 social medias posts that we've created. And I really like these 2 posts, but the first one is what we heard. So transportation challenges make it hard to get appointments, and what we suggest, offering mobile clinics at convenient community locations. And just, so this was done, our assessment was done in April. And so we heard, these are different things that we heard from the community. And we immediately started to take action to try to assist those barriers that we were hearing and seeing. And so we partnered with Walgreens and Filling in the Blanks Food Pantry. They hold a food distribution monthly that sees upwards of 300 residents in the community. And Walgreens was looking to partner with community partners to offer free flu shots in Norwalk. And so Omar and Kelly and Jalea all attend sometimes these food pantries, so distribution sites. And so we're already a trusted source at those sites because they see us coming to, give information about our services and programs. And so when Walgreens reached out to us, we knew that Filling in the Blanks would be a great partner for them. And so Omar did attend that day, and he assisted with translation and encouraging and answering questions about the flu shot. And Walgreens was able to vaccinate over 60 residents for free that day. So while we heard this challenge, getting to appointments is challenging, we were able to bring a mobile community clinic, right to the people while they were waiting in line anyways. And so I don't know if those folks would have gotten vaccinated otherwise. And so that was a great win in all sides there. And then the next slide that you see is my pediatrician is my most trusted source. And so we heard this, and then also the data that Omar is going to present is going to show you that pediatricians and providers are seen as the most trusted source, which I love that. And this is a direct quote from some of the participants. And I just want to mention the work that IAP, so Pam and Sarah do. They work closely with providers to ensure that they have all the resources they need to meet the client's needs. And so I think it's just really important that we remember that the pediatricians and providers are the most trusted source. And so the work that we're doing in IAP to really support those pediatric offices is really what we need to be doing here. And then lastly for me, ways we're utilizing this data in this report. And so here are some ways. So we submitted an abstract to the Connecticut Public Health Association conference. That was back in November, and Omar presented on the rapid community assessment and the importance of partnerships in the community when conducting an RCA. We also recently have conducted a flu quality improvement project where we used some of the data from this report and this assessment for that work there. We're also using it for FAB accreditation, so for the annual report and for reaccreditation to meet some of the measures there. And then, like I've mentioned, we're also using this data to drive our work to ensure that we're focused in the right areas. And then always thinking and using evidence-based approaches when delivering this work. And that's all I have, and I'm going to turn it over to Omar Perez, who's an amazing community health worker and who's done a tremendous amount of work on the RCA. He was out in the streets promoting it and getting people to complete the survey. He was helping in listening sessions. And so this is really his RCA. So turning it over to Omar.
Thank you, Megan. Thank you again for letting me speak in front of you all. So now I'd like to dive into how we collected data. So we held intercept interviews, key informant interviews, listening sessions, and an online survey. With the intercept interview, that's an informal conversation that's already included a set of open-ended questions where we sought out to gather thoughts and beliefs on childhood vaccines. For example, we would go out to a children's playground to speak with parents. We would also go out to pediatric offices to try to hold these interviews, and as well as preschools. We also held key informant interviews where we sought out individuals with great expertise and great knowledge in vaccination services. With their participation, they provided information on community perceptions of vaccines or childhood vaccines. They could highlight any barriers that they saw with their, again, their expertise, and they identified enhancers relating to routine vaccine uptake. Next, we held a listening session where it's sort of a group style conversation, also having a set of open-ended questions, really wanting to gather information on, again, the community's perceptions of childhood vaccines, their perceptions on the healthcare system, trying to make appointments, really learning about their barriers and what enhancers help them to get those services that they need. And also, lastly, to gather community-driven recommendations to improve on those barriers or access to vaccination services. And lastly, we had an online survey, which was created in collaboration with the Yale Griffin Prevention Research Center. this helped us to understand the preferred communication methods of residents. For example, if they prefer to hear information through social media, through newspaper, through maybe in-person outreach. And so we learned a lot from that online survey. And we also gathered, again, the community's attitudes and perceptions on childhood vaccines through a set of questions. The survey was anonymous, it was voluntary, and it was also offered in English and Spanish. Next slide, please. So I'd like to highlight some key findings from the survey. Next slide. So medical organizations were the most trusted organization that respondents answered at 63.2%. Schools followed by 54.4%, and surprisingly, the police department at 51.5%. Next slide, please. 40% of respondents said it was a little possible for their child to be infected with routine vaccine preventable diseases. 29.2% of respondents said it was not at all possible, and only 10.8% believe it is very possible. Next slide, please. Now, 75% of respondents think it is very important to get routine childhood vaccines to keep their child healthy, while a combined 15.4% believe it is not at all important or only a little important to get routine childhood vaccines for their child. This shows some considerable skepticism and even minimization of the importance of childhood vaccines. And so this is a great detail to know and to help us move forward to see where we can improve on education on routine childhood vaccines and the importance of it. Next slide. 60.9% of respondents think routine childhood vaccines are safe. And a combined 18.7% believe it is not at all safe or only a little safe. Once again, this here shows some hesitancy towards childhood vaccines. Next slide, please. Luckily, we also heard some positive feedback during our listening sessions, key informant interviews, and intercept interviews surrounding childhood immunizations, and even the Norwalk Health Department's efforts in being out in the community. So, for example, most parents supported recommended vaccinations and didn't experience significant barriers. Most parents see their healthcare provider and pediatrician as their most trusted source. Several respondents noted that in-person outreach from the health department and other partners are successful and much appreciated. And lastly, a lot of the community residents believe that the health department did a wonderful job during the COVID-19 pandemic to get a lot of people vaccinated, and that in turn gained us a lot of trust within the community. Next slide, please. All right, and then in the following table, we have listed some barriers that we heard during some of the key informant interviews, listening session, and intercept interviews. For example, a lack of transportation to medical appointments is something that a lot of residents have, and also a limited availability and long wait times for appointments. The continued need for information and services to be available in preferred languages like Spanish and Haitian Creole. They want stronger communication and education from providers on why vaccines are needed and important. And they want more of an open conversation over the possible long-term side effects of vaccines. And there was a self-reported increase in anti-vaccine attitudes since the COVID-19 pandemic. And despite many years of research and evidence, there are still concerns surrounding the incorrect association of vaccines to autism and sterilization. Next slide. And again, in the following are recommendations and suggestions that were created by the Norwalk Health Department to combat the barriers listed in the previous slide. So we recommend informing parents and families of all Connecticut vaccine program pediatric providers in Norwalk. We suggest partnering with other key stakeholders to provide vaccination information and resources. We recommend providing information about common mild side effects such as injection site pain and fever and how to manage them. We would also like to suggest providing reliable educational resources to parents who have more questions or concerns about vaccine safety, or who want more vaccine information to feel that they can make a decision to vaccinate their child. And unfortunately, we did not include all the barriers or recommendations or suggestions that we have, but all of them can be found in the RCA report. Next slide. And so I'd like to thank you for your time, and I can open up for questions now.
Thank you, Omar. Anthony, do you have a question?
Yeah, I'm only just skimming the PDF. So if this is a naive or ignorant question, I'll apologize in advance. But with the I look at the kindergarten survey table that has all the percentages by school. So so a few questions. One is, that's data based on the parents' perception or knowledge of their kids getting certain those vaccines, right?
I'll speak on it and then I can defer to Brian if he can, but I think those are the reported numbers of vaccinations to the school. So I think those are the reported kindergarten vaccination rates.
Okay, got it. So it's from the school, not from
Isn't
the
that
parent.
from Connecticut Whiz?
So I'll speak to this. Yeah, so this is reported from to the state, so to CSDE. So this is reported out, and then it's vetted by the state health department, and yeah, it's looking at the different grade levels in terms of the uptake of vaccines. So this is reliable information because this is looking at the actual exemptions marked off relative by the parents.
Yeah, perfect. Then my follow-up question is, so it should be 100%, and I know that that's not always realistic for all sorts of reasons some explained earlier. So, but I just want to make sure I'm understanding this right. But the kids really shouldn't be enrolled in a public school without those vaccines. And I know the sample sizes vary, and there's a lot behind vaccination uptake and things like that. So I'm just wondering if maybe the report, especially for the lower schools, because there's a couple of schools that either there's no information, or in the high 80s, or even not the 90%, if the report maybe should be used for some, I don't want to say advocacy, but maybe more intervention to the schools, particularly those on the lower end, which there's just a few of the, I don't know, dozen or so schools. I just think it's an opportunity maybe for, I don't know, beyond what's already happening with the reminders about the importance of vaccinations, just because those are, I think sometimes people, I know I'm preaching to the choir here, but I think sometimes lay people don't recognize or realize the community benefit to vaccinations, and they're just kind of focused on their own individual family, which is important. But I don't know, I was just kind of struck by the lower numbers. But I know it's a complicated issue that, so anyway.
The number of state requirements of vaccinations for kids is quite high. I know because my wife was head of the nurses in New Canaan. And while it should be 100%, there are always those that try and evade it, or the religious exemption, I believe, has been cut back dramatically, because that was just every mom's way to say, oh, no. But I think the survey you did was very interesting, although it's a small number. The confidence expressed and the 10% skepticism, I think it reflects what's going on nationally. Everybody's aware of what's going on, and then the CDC, and then the new Secretary of HSS. So I think that your recommended solutions look practical and reasonable, and I think the program's doing pretty well, all things considered, the environment we're in.
I just wanted to go back to Anthony's, thank you for, looking at that. And so the Norwalk region is the highest vaccinated community in the state of Connecticut, and that's thanks to Pam and her work in the IAP program. And so overall, Norwalk does a pretty good job at making sure that their children are fully vaccinated by age 2. And we work closely with our school nurses and the director of school nurses to ensure that, children are getting vaccinated or having their physicals done before they enter, school. I think it was challenging, and we did hear it during COVID, to get children in for their physicals and get them up to date on vaccines that they might have fallen behind on. But again, this is why I think it was crucial that we had this report, right? Because we can point to it now. So when we're having those conversations or looking to do additional education and outreach and programming, we have this report to reflect back on. And I think Joan raised her hand too.
Yes, my comment is, excellent job. And it's just great to see this information laid out. My question is this published already? Is this public knowledge? That's my first question.
Yeah, so it's posted on our website.
On the website? Okay. And then my follow-up comment is, I'm just blown away that churches are right now at 30%.
Yeah.
30% for churches. That, I mean, when did we get there as a society? So that's my follow-up comment. I'm just blown away by that number. Yeah.
Yeah. So that's usually surprising. I know during the COVID-19 pandemic, we partnered a lot with churches to get folks vaccinated. And so that might be something that we look at with our community health worker and other outreach workers to continue maybe that partnership there. And see if we can get back into the churches, because we know a lot of information is shared in, in faith. And so that's an important partner to have. Thank you, Joan.
You're welcome.
Frank?
Yeah, I guess this is more of a comment than a question. I think the work here has just been phenomenal. My only comment, though, is I think we need to address any response to the negativity that's out there in the language of those people who are negative. I think we tend to say things like, well, the incidence of autism has been shown not to be related. I don't think the public that has those negative views can accept just being told that the incidence of autism isn't greater. I think we need to have data presented in a language and a methodology that the public will understand and can understand, not in languages and methodology that is foreign to them. I think we need to address where the negativity is occurring, why it's occurring, and figure out the methodology to deal with it at that level. And I don't think the feds are doing it. That's for sure. They're not going to do it. The new Secretary of HHS has his viewpoint. And I hate to say this, but and you can cut it out of the minutes if you want. He is the enemy, and we need to deal with it. I'll say it. Cut it out. I understand. We're not supposed to say that, but that's where we're at.
I think it's also coming out, he's made some small moves to change some of the people and what's going on in the department. And so he doesn't have to rule out a vaccine, but he can change some of the people who are on the board. He can do a lot of things. So it's of concern, but We just have to follow it. I think he's especially ignorant compared to the people in that position before, put it that way.
Agreed.
I'll
Thank
just
you.
add, I think that, this work it's really great. And I think we're just going to continue to build on it and taking all your suggestions that the board members have placed today. And I think, there is some research and movement going on, and we look at the research site, we look at what are the best practices for communicating about vaccines and how do we combat that misinformation, and what you're saying, Frank, about how do you put it in language that, people will understand. So I think we just continue to build on that. We continue to find, what are the best ways to talk about, vaccines? What are the best ways to talk about the misinformation that's out there? So thank you for all your comments. And
I
your
think Frank is
suggestions.
right, though, trying to give them some facts related to, other than just saying, oh, it's been shown it's not connected. People don't buy it. So we have to give them something
Yeah.
concrete.
Yes.
And we, there's organizations out there like the Public Health Communications Collaborative that we've looked at, and utilized before. And there's also some, we're connected to some of the national networks of other, local health departments across the country. So we'll continue to look to those resources too, to figure out how we can make our communication even stronger.
It's interesting. When I was a surgical resident, one of the things I was taught when I was going to give a lecture is you always give the lecture to the individual in the audience with the lowest level of understanding, the lowest level of knowledge about your subject. That was the level you gave your talk at. And that's what we need to do, I think, when we present data to refute vaccination claims and similar claims in other health areas.
Thank you, Frank.
Thank you.
Any other comments or questions?
If not, thank
Thank
you so much for having us.
Thank you
Thank you.
Thank you, Megan. Thank you,
Very
Omar,
good
for
job.
presenting.
Good
Thank you,
job.
Hey,
Cynthia.
everybody.
Good job.
All right, our last presentation is going to be by Kelly Tomlinson. She is our health educator, and she's going to share some of the wonderful highlights from Heart Health Month.
Let me just share my screen. You guys see this okay?
Yes.
Yeah.
I know you're putting into presentation. Yep, perfect. Thanks.
All right, so this is short and sweet. So I'm just here to share today an update on all of our National Heart Month activities and all the fun things we got to do around heart health over the past couple of weeks. And so each February, we have the good fortune to raise awareness on the importance of heart health through a series of different campaigns, programs, and services throughout the entire community. And so a lot of the work is continuing on things we do all year round. But we were able to launch 2 new heart health initiatives this month, which we're incredibly excited about and are excited to share with you. And so Heart Month always kicks off every single year with Wear Red Day. It's always a tongue tie, but it's the first Friday of each month, and it's through the American Heart Association's Go Red for Women campaign. It's always just a fun way to really kick off Heart Month and a visual reminder. So we at the health department wear red and try to spread the word. Prior, we tell all the community partners to wear red to really push and have that visual reminder as a conversation starter for why everyone is wearing this color, and start to talk about heart health and all the importance of making sure you know your health status for heart health. Next up, we have Know Your Numbers. And so in the years prior, we had started this Know Your Numbers program, which was originally a health screening back in 2022. And this year, we were able to kind of change it into a Know Your Numbers kind of umbrella of different heart health initiatives under this kind of one larger program, which we're very excited about. And so I'm going to talk about each one. And so the Know Your Numbers health screenings are a health promotion and chronic disease prevention program where we go out into the community to offer free health screenings to residents. The goal of these health screenings is to really help residents understand their health status, this kind of snapshot in time, to really motivate people to take preventive action for their health, connecting to community services, such as food banks or food options, as well as healthcare, and linking them if they don't have a medical home or if they don't have insurance. And so it's really this kind of understanding your health status, but then how can you move forward to take those action steps for heart health? This month, we were able to hold 4 screenings. We went to the Norwalk Public Library. We were able to partner with Lifetime Learners. They had a cardiologist doing a talk, so we were able to pair with that and do a Know Your Number screening ahead of time. We went to Open Doors, their kind of hub at the Smilo Life Center. And then we were able to do one at City Hall for employees. And so with these 4 screenings, we were able to screen 51 participants. Because we just wrapped the last one up, I don't have the kind of breakdown for our February month just yet, but looking back at kind of the work we did in 2024, throughout last year, we were able to complete 22 screenings with 140 participants. And we are seeing elevated numbers each time we go to a screening. And so 63% we're seeing have an elevated blood pressure. About 37% we're seeing an elevated A1C blood sugar level. 19% of people are reporting they don't have insurance, with almost 24, almost a quarter of them reporting that they do not have a medical home. And so of these 140 participants, we do refer about 77% of them to follow-up care, whether that's getting into a medical home, making a visit with their healthcare provider, seeking out insurance options that work for them, or at least calling their doctor to let them know that, a screening showed an elevated number and kind of what are those next steps. We also provide community resources. We partner often with the Community Resource Hub that offers information on different services, whether it's housing, food, clothing, any kind of resource for a basic need that they would need. We have that partner. And we oftentimes also have Newark Community Health Center on site to provide a medical home or more information on obtaining one if that question is raised. As part of the program, we do try to do a follow-up call just to check in, see if there was any barriers to obtaining that follow-up call, if they have any additional questions, need any more health education. And so of those that had that elevated number, we were able to speak with about half of them. In terms of our partners, we regularly go to the library and Open Doors. They've been amazing partners to let us go once a month, so that we are doing 2 screenings a month at minimum. We have our wonderful emergency response team volunteers that really help with the screenings, as well as our health department staff has been so critical in helping with the success of this program. We also have Nuvance Health had helped us with a small award, I guess, for lack of a better word, that helped us kind of obtain some of the supplies needed to keep going. So it's really a huge benefit to our partners that we're able to keep this work sustained.
Kelly, could I ask a quick question?
Of course.
Those numbers you have, there's 64% elevated blood pressure. Do you know out of these people, how many knew they had a history of it, or was this the first time they found out they had
That's a wonderful question. It's a little, I would say more leaning more to the side of a lot of them knew it was a little bit in the elevated category. Some of the people were already in touch with their doctor and taking medications. Interestingly enough, a lot of the very elevated ones were in touch with their doctor and trying to figure out a way to lower it. And so, but we do have those handful of people that showed up for the first time completely unaware that their blood pressure was elevated. And definitely with their blood sugar, not realizing that that was elevated either. So I would say a mix.
That's good.
And I believe that was all I had for that one. And so the two new programs that we were able to launch just this month is in partnership with the American Heart Association. And so really with the goal of expanding access to knowing your blood pressure to take preventive action. And so the first program are these self-monitoring stations that we have placed around the city. And so we have them, the pictures that you see here are at the Norwalk Senior Center. We also have one placed at the regional YMCA. We have one at Elder House, which is a senior assisted living kind of care facility. What's great about Elder House is their willingness to partner. They share a parking lot with a daycare and then are also right down the block from a church and have shared flyers for those in those two buildings to come to Elder House to also use this station, which is really nice. We have placed one at Person to Person. And I believe that is all of our spots. I always feel, in our library, I always feel like I'm missing one. And our library, which has partnered with their telehealth program to have it centered so that if someone's on a telehealth call, they can take their blood pressure in real time. And so the self-monitoring stations, we provide the privacy screen that has multilingual instructions on how to actually sit and take your blood pressure accurately. And then you can see at the bottom, it has the ranges of what those numbers mean in terms of elevated, normal, or kind of these two stages of hypertension. In the kit, and I'll show a picture of that prior, but inside the kit, they'll have the automated blood pressure monitor as well as the cuff, a tracker, so you can write down your numbers and take it with you. It's a little wallet card. You can take it with you over time. And so at each time you come back, you can track it to see your progress of how your blood pressure is doing. We included literature on, again, how to take those instructions on how to take your blood pressure accurately, so you're getting the most accurate reading. We have health education on how to lower your blood pressure, some tips and strategies as well, again, kind of what do those numbers mean and why it's so important to lower those numbers. And then we had created a guide for those that are underinsured or uninsured on where you can go within the city to obtain a medical home if you do not have one. And so we also provided our flyer for additional health screenings out in the community if they would like to come and do additional readings as well. Again, we just launched these. We're interested. We were going to wait about a month and then follow up with all of our sites to see how it's being obtained, any feedback from the public that are utilizing it, and kind of do this quick kind of turnaround assessment to see how can we improve it for utilization going forward. The second new program we launched is our blood pressure kit lending program with the public library. And so with this program, residents can check out a blood pressure kit from both branches of the library. So we have it implemented at the main branch as well as the South Norwalk branch. So you can check out these kits for about 2 weeks to then monitor and evaluate their blood pressure kind of from the comfort of their own home. And so the kits are very similar to what you see at the screening stations. So you have the automated blood pressure cuff, you have the monitor, the tracker, so you can track it over time. There's health education within the kit itself for those that are getting taken home. And then all of the library was trained on how to erase kind of the numbers upon return so that you can kind of keep everything confidential, as well as kind of some cleaning strategies to make sure that it's safe for use for the next term around. But it's a really, the American Heart Association has done this program in other states with incredible success. And so we're really looking forward to providing this opportunity to get more people to understand their health status and have this access to blood pressure screenings at the comfort, of where they are. So moving forward with other Heart Month activities that we do, our clinical team every single year does offer this free rapid HIV testing so that residents and their partners can come in, get tested, receive education, as well as some HIV prevention and treatment options. They do it for the whole day. It's walk-ins, really try to remove all those barriers as much as possible. And then lastly, I touched upon this a little bit, but just we want to make sure that we embed resources and education throughout all of our programs. We really lean on American Heart Association's Life Essential 8. It's 8 tips for improving kind of overall health. They have fact sheets on each individual one that really break down in an easy to understand way, kind of the best 4 things you can do to help that one topic, kind of what it means to be in a normal range, why it's so important. So it's a really great resource and education tool that we rely on. We promote our Norwalker maps to really encourage that physical activity. And then our Norwalk Food Alliance. And so the Norwalk Food Guide is updated quarterly, and it is a comprehensive listing of all of the different food banks, food pantries, mobile food pantries, and food resources in the area for individuals looking for kind of some food assistance. And so we always make sure that these resources are provided at all of our education points within these programs. That is all I have. I'm happy to answer any questions you have about the programs. We, launched these as Heart Month as a really kind of conversation starter, but we're really excited that we have all of these programs to really offer all year long and to kind of build up and promote, over time. So it's a really great kind of ongoing opportunity. But thank you so much for letting me present. I'll stop sharing.
Thank you, Kelly. That was really great. Does anybody have any questions for Kelly? A lot of exciting programs and great seeing, the great ones continue and adding new ones. So thank you, Kelly, and to the whole team. All right. Last on the agenda is the director's report. So I know we got to wrap up, but just want to let you all know that, I announced last month that Dr. Reed is retiring, and I thanked him for all his years of service. So thank you, David, for all that you've done for the health department over the many years that you've served. We're currently working with our personnel department to get the job posted. So everything is ready to go. So we should be able to post it real soon, just as soon as it gets posted. Then we'll share it with everybody, and then we can start, the recruitment process. But thank you to David again, and thank you to David for staying on until we were able to replace him. We really appreciate it. And then lastly, I just want to say the budget. So the recommended budget has been posted, and you may recall one of the positions that we had requested to become full-time on the city operating budget is a public health nurse, because the grant funding is coming to an end. And so I'm really happy to share that that position is currently in the recommended operating budget for next fiscal year, so to be able to continue having that really important position in the health department. We did request that our part-time relocation evictions coordinator be transitioned to full-time to continue to help with that work, and then additional enforcement work, including lead. That's not in the recommended budget at this time, so we'll be going to the BET next month and making our case for why it's important. But I did want to share that the public health nurse is in the recommended operating budget, so I was really thrilled to see that. Is there any questions, anything else before we wrap up today?
Has anything changed with the grants, that were paused, not paused?
Yeah, so some of them were, we get updates from the state health department, and so right now we're sort of, some of the ones we're able to spend, as we're maintaining our staffing levels for the grants that we do have. Some of the grants were given like sort of the green light to spend on other purchases. Other ones were sort of monitoring. So news is getting better there too.
Who's making that decision?
We're working with the state health department on that, and obviously with Lamonde, I know the Chief of Community Services and the mayor's office. So we're getting a lot of our news and updates from the state health department.
Be nice to have a trusted source.
Any other questions? All right, hearing none, we will adjourn at 9 a.m. And for the purpose of the minutes, I just want to mention that Janet Karpiak has been on the whole time too. So we have all our board members present, and Teresa Argandesi also joined, our Assistant Director of Health. All right, thank you, everybody. Hope you all have a great day.
Okay.
How was your vacation?
Bye, everyone.
Bye.